Hi, it's the nursing professor, and today I want to talk about the importance of vital sign measurement. Vital signs can tell you whether a patient is doing really well, doing poorly, or look like they're getting ready to have some problems. So sometimes I think we discount the importance of just taking a good set of vital signs, which kind of helps to give us further information about what's going on with the patient. So it's part of the assessment phase in the nursing process, the ADPI. So you definitely want to make sure that you are taking or you get a good set of vital signs. So temperature, normally we take temperature in adults by mouth orally. And we normally do that by using, these days we don't use the mercury thermometer like we used to back in the day. And we use the digital ones, I'm sorry. And so you normally ask the patient if they've had anything to eat or drink within the last 20 to 30 minutes. And if they haven't, then you can consider that your measurement will be accurate as long as they are able to keep their mouth closed over the thermometer. So you'd ask them to open their mouth and you would insert the thermometer to the left or right of the frenulum. And that's the thin little tissue that hangs in the base of your tongue. That's the frenulum. So the pocket is directly on the side of that. So you want to insert that in there and ask them to close their lips around it. And the thing will beep. Once the thermometer beeps, then you'll see what the measurement is, and you want to write that down. Too high would mean that they have a fever, and that can signal a sign of infection, some type of infection somewhere, whether that's viral or bacterial. Too low can also be a problem and can signal hypothermia. So this is like a very quick look at the patient. Are you in normal temperature range? The next thing we look at is a pulse rate. Pulse is the measurement of the heartbeat, and what you're doing is measuring it at a spot where you can feel the pulse, which is basically the waves that the heart is when it's contracting. Then the squeeze gives a wave into the vessels, and you can feel it when you palpate it. So the radial pulse is one of the ones that we use the most, and that is found right inside the wrist. And it's usually, if you draw an imaginary line from the pointer finger over and right down, it's like a little crevice that kind of goes in a little. That's exactly where you can find it. You never want to measure a pulse with your thumb because your thumb has its own pulse going on. So you don't want to count yours thinking it's the patient's. So you use your second and third, and you would use a second hand watch, and you count it for a full 60 seconds to get the most accurate measurement. A normal pulse rate is between 60 to 100 beats per minute. Now, there are athletes who can run lower than that and be completely, totally okay. And there are some that run slightly higher than 100, but usually you don't see much higher than about 104, 105 as a norm, let's say. But the normal rate, we'd say, is between 60 to 100. Now, what does that tell you? Well, too high could say that you have a fever. It could also signal that you have shock going on. It could also say that you are having some type of cardiac rhythm dysfunction. It could be electrical. It could also be that you're in compensated shock. There's a lot of things that could be happening if you have a too high pulse or too high heart rate. Too low could also signal problems with your heart rate function, whether that's electrical or actual your heart is not pumping well enough, so that's physiological. It could be myocarditis, hypothyroidism. It could be a bunch of things. So as you see, a measurement of your pulse can give a quick glance at what could or could not be going on, what's going on with the person. Next thing would be respirations. And you are best to measure respirations when the patient is not aware that's what you're doing. Because sometimes when they can see that you are doing that, it can unconsciously cause them to change the way that they're breathing. So we often tell people to take the pulse and you hold on to the pulse for longer as you look at how often they're breathing. So the normal breath rate for an adult is 10 to 20 respirations per minute. And again, there are small variations that can happen in there that would be totally okay. But you wouldn't want to see somebody at 30 breaths per minute as an adult, because that wouldn't be normal. So too fast could mean that they have problems with asthma, or they are in pain. They could be stressed. Too low can be also that they are having problems with shock or other things going on. So these are, again, quick little things that you can measure that will give you an idea of what's going on with your patient. The last is blood pressure. Blood pressure is a measurement of the pressure that's on the vessels in your body when your heart beats, when it contracts, and when it's at rest. And so the top number is systolic, and that's the measurement of the pressure in the arteries during systole, which is when it contracts. And the bottom number is the diastolic, which is the measurement of the pressure on the vessels in your body when the heart is at rest. So it's not when it's contracting. So it's in between those beats, and that's diastole. So the normal you want to be is less than 120 over the top, systolic, over less than 80 on the bottom. And those are the norms. You are considered high blood pressure if you are above 140 over 90. Now, too high can mean a heart attack, a stroke. It can mean an aneurysm, kidney failure. It can cause all of these things by having too high blood pressure. It can also mean that there's cardiac dysfunction going on, and that could be rhythm-wise, like your heart is not beating right, like there's something going on with your having a mind block. It'll come back. Too low could be shock. Hypovolemia, meaning you don't have enough fluids on board. It can also mean that you are in some type of heart block. It also can be a cardiac problem, meaning that your ventricles are not contracting in the way that they should. So as you can see, getting a measurement of all of these vital signs are important because it can give you some important information about what's going on with your body. The last one would be an O2 saturation, and that is done when there's a small little electrode that's placed on a patient's finger, and it gives a measurement of how much oxygen is flowing through the body. A normal adult, you would expect to see them 94 to 100. Someone with COPD, you'd expect to see 88 to 92, and that's about normal for them. And that also gives you an idea. Are they oxygenating enough? Do they have enough in them? Do they need supplemental oxygen? So as you see, measuring these things can give us a good picture of what's going on with the patient.